Come in.
Hi, Dr. Jones.
Hey, how you doing?
Good. I'm Darlene with AstraZeneca.
Oh, come on in. I was expecting you. Have a seat.
Thank you. You doing okay today?
Pretty good.
Good. So, we have made this appointment and I just wanted to come on by and visit with you for a little bit.
Okay.
All right. So, you having a busy day today?
It is okay.
It's okay.
Yeah, it's
okay.
much needed. Yesterday was a nightmare and today it's kind of slow.
Okay,
So,
good.
pretty good.
Good, great. Well, today's Veterans Day. Are you a veteran?
Yes, I am.
Good.
Actually.
So what branch of the military did you?
I spent 5 years in the Marine Corps.
Really?
Yep. And then I got out and went to med school and went there to get college.
Awesome.
You know, and then got out and yep. So yeah, today's been a pretty fun day so far.
Awesome. Well, thank you so much for your service. I do appreciate
Oh,
that.
thank you.
So, can you tell me just a little bit about your patient base here in this clinic?
Well, this one we usually get males, usually between 50 and 65 years old.
Okay, all right.
Is majority of the people that we see.
Okay, males, a little bit older for their working age. And so, with that group of patients, what kind of diagnosis do you usually see?
Oh, I would say high blood pressure. That's probably the number one.
Okay.
A lot of fatigue.
Okay.
And that's about it.
Okay.
You know?
All right. Well, they sound fairly healthy, but so with those diagnoses, do you do lab work on them?
Yeah. Yes, we
Yeah.
do. Yeah.
Okay. So in that lab work, do you generally see high cholesterol?
Oh, yes.
Okay.
Yes.
All right. So with high cholesterol and say diabetes or high blood pressure, it'd be really important to keep their cholesterol low then, right?
Oh, most definitely.
To treat their cholesterol. Okay. All right, because I guess that would complicate their other diagnoses if their cholesterol was
Exactly.
high. Okay.
Yep.
All right. All right. Well, good. So the company that I represent is AstraZeneca, and they manufacture Cresor. Have you heard of Cresor before?
Yes.
Okay.
Yeah, I've heard of it.
So for the patients that you see, what is your number one choice of drug? Do you prescribe Cresor or Lipitor or Zocor? What do you?
I mainly use Lipitor.
Lipitor. Okay.
That's what we prescribe.
Okay. All right. So with Lipitor versus Cresor, can I just give you a little bit of information about that?
Sure. Yeah.
Okay. So there was a trial study, a 24-week trial study comparing Cresor to Lipitor. In that 24 weeks, they did intervals of blood testing and face-to-face study, the exact same dosage of Cresor versus Lipitor. At every interval of the blood testing, Cresor beat Lipitor every time.
Oh, really?
Yes.
And that's a private sector testing.
Yes, yes, it was individualized. It was not done by Cresor. It was an individual.
Right, outside
test.
party,
Yes.
third party
Mhm,
testing.
mhm.
Huh.
Yeah, so we're pretty proud of that drug, Cresor. So that would be a really good drug of choice for cholesterol.
What's the cost of that?
Well, Cresor is more expensive than Lipitor. It does cost a little bit more, but like I said, you'd be treating your patients with the best possible medication.
Right.
So there was another trial study done comparing Cresor to Zocor, and Zocor 20, 40, 60, all the way up to 80 milligrams compared to Cresor 20 milligrams. It beat Zocor every time, regardless of the strength of Zocor. So again, yes, it is more expensive, but it does work the best. And wouldn't you want your patients to get the best medical treatment?
Oh, absolutely. Yeah, you know, and 20 milligrams per compared to 80, that's pretty impressive.
Yeah, and so maybe they wouldn't have to buy as much, you know. Now I could offer you some samples to keep here in your clinic. I could come once a month and keep your medicine cabinet stocked, and we could stock different milligrams. But again, that Cresor 20 milligrams is just a wonderful medication. So what do you think about that?
Well, how long has it been out?
Cresor's been out for several years, and the nice thing about Cresor is, again, like I said, it's more effective. It's just the better medication.
So maybe it's just cost more because they haven't streamlined the process of making it yet. Is it still considered a new?
It is still
drug?
considered a new drug. It is still under patent, but to also help you offset your costs to your patients, I could give you some coupons so that you could pass along to your patients. So then you would be able to give them their first prescription out of your medicine cabinet that I'm gonna fill for you with samples, and then you could give them coupons to kind of get them going to offset that initial expense.
Yeah, because if it, you know, I believe if it works, then you pay the extra. You know, you get what you pay for it.
Right,
You know,
right.
so once maybe let's say the word gets out, and it does work, then you know people won't be so worried initially about the cost.
Right, right. That's
So that sounds like a good, like an introductory.
right, exactly. I could also maybe get you some information that you could share with your patients. We could do some educational pamphlets for you to give out to your patients.
That would be good.
Yeah. So the guys that you treat here, are a lot of them veterans as well?
Yeah, a lot of them. We're a military type business. You know we get a lot of military people in here.
Okay, good.
Ex-military, retired, whatever.
Yeah, well, happy Veterans Day to you and to all of them, and thank you all for your service. I do appreciate that.
All right, well, thank you.
Yeah. So, is there, what made you want to become a doctor?
Well, actually, I love building stuff. And I built a lot of stuff, and the Marine Corps actually tested jet engines. But my sister got sick, and I wanted to know the mechanics of the body. My brother-in-law is a chiropractor, and I learned a lot from him, so I don't know, I just fell in love with it. You know, and it's like you can't ever stop learning.
Right.
Every body's different. Every, you know, male or female, they're different, and then it changes as they get older. So it's like a continuous challenge. I just love it.
Well, great. Well, we're so fortunate. These guys are so fortunate to have you as a doctor. That's I can see the passion that you have for what you do. And that's another thing about the company that I work for. They work really hard to create the best medication and to take the best care of the patients that they treat. And Cresor is a little bit different than some of the other cholesterol medications. It works in a twofold way. So the cholesterol that's already in the body,
Okay.
it works on breaking that cholesterol down so that it can be what they call uptake, and I'm sure you understand all of that since you're a doctor. It's uptake, and then it dispenses out through the liver. It makes it easier for the liver to process that cholesterol out of the body. And then the other side of the medication is that it actually helps the body to not create as much. Because you know, some people with high cholesterol, diet and exercise is just not enough.
And it's still high.
It's a genetic condition, and so Cresor is ideal for those type patients that just cannot control their cholesterol with diet and exercise alone.
Well, what if in some of those tests, I know they've bound to have done a number of them, is the side effects? What do they compare to?
The side effects for Crestor are no different than, say, Zocor or Lipitor. The general side effects of any cholesterol medication are headache, nausea, vomiting, and you know, usually these things they're not significant enough to cause the patient to stop using it. The benefit outweighs the risk. So it's just some kind of minor inconveniences, some muscle pain, headache, nausea, vomiting, abdominal upset. You know, just real typical. But they're generally
It kept in line with the other medicines.
Yes,
and there was nothing that stood out.
No,
That was a
they're the same
blurry vision or
Right.
something like that.
Right, they're
okay.
the same type of side effects that you see with any cholesterol medication. So, so what made you prescribe Lipitor in the past?
Well, it was cheap
For your patients, it's cheap.
for you know, it was cheap. It seemed like it worked for everybody. You know, it seemed, you know, in my opinion, it was okay, but they were happy. You know, it's hard to break people of
Right.
money, of how they think. They think, well, this is all I can afford. I need to get on it. You know, and it does a little bit good, but it doesn't do perfect.
Right.
You know.
Well, in that study that I mentioned, the Stellar trial, where Crestor was compared to Lipitor, 52% better results with Crestor compared to Lipitor. So 52%, that's more than half of a better result. I would think that would be significant.
Are y'all aware of any tests that y'all did for, like, you take a patient that was taking Lipitor and then you put them on Crestor and then gauge those numbers?
So the clinical trial that they did was a direct head-to-head treatment. It was, you know, those patients taking Lipitor compared to those patients taking Crestor. It was actually a head-to-head trial. So.
Oh, okay.
But it's a significant study. It is, and like I said, it was an independent study. It wasn't performed strictly by Crestor. It was independent, and with positive results every time at every one of those intervals.
How long have you been selling?
I've been with AstraZeneca for about 5 years now. Prior to that, I was actually a nurse. So,
oh, really?
Yeah, so I understand a lot about medical, and I'm proud to represent such a great company.
So you firsthand know what high cholesterol does to
Yes.
Yeah, and it can get out of control.
It can be one of those underlying conditions that's, you know, like high blood pressure. It can be a silent killer. So you can have high cholesterol and not be aware of it. And like I said before, you know, some patients may try very hard, very diligently with diet and exercise to control their cholesterol, but not be able to.
Do you have anybody that you know that is taking Cresor?
You know, I visited with my mom and my stepdad recently, and it was kind of funny. My mother takes Lipitor, and my stepdad takes Zocor.
Oh, really?
Yes. So I visited with them.
That would be a pretty good test.
That was a very good test.
Yeah.
I visited with them a few weeks ago. I talked to them about AstraZeneca. I talked to them about Crestor, and they both went to their physicians and asked to be changed. They have really good insurance, so the money wasn't an issue for either one of them. But I just feel better knowing that they're getting the best treatment that they could get.
Yeah, absolutely.
You know, if you have to take that pill every day anyway, why not take the best one that's going to get you the best results?
Well, let's say we did get something started here, and I really like the idea of getting a little bit here, maybe some coupons, get a few of the guys, you know, that are okay with it, you know, and to build that rep of it,
Mhm.
and then the word could get out.
Mhm.
But how often, like after that, what would be your routine of like stalking?
I would come monthly to make sure that your medicine cabinets contained the appropriate amount of
Okay.
samples. So once a month, I'd be able to come back and help you. I would also like to offer you a DVD that you could play in your waiting room while the guys are waiting, just to educate them better, because we think that patient education is so important.
Right.
And then also those pamphlets that I mentioned earlier. So along with we give you the samples, we get you coupons, the pamphlets, and the DVD to have. So if I'm understanding you correctly, you'd like to just start with a few patients and see how it goes, and then maybe switch or encourage
Yeah,
some
that,
others.
yeah, because I mean the numbers sound really good,
Mm-hmm.
you know, and to tell you the truth, I'm actually seeing a trend where the other drugs are not really working that well.
Okay.
It's like my patients are settling for the price,
Right.
and then they're just settling for this mediocre
Right, and you
cholesterol.
can't put a price
fix.
on your health.
Right. So I think we'd have a better and be actually faster to fully implement it if we do like a soft hit, like
Okay.
or we call it like a soft approach to maybe a handful of guys.
Okay, all right,
Because I think once the word gets out, that's the fastest way to spread,
right.
you know, spread some good word on medicine and whatever. So
Okay, well, that sounds great.
I think that would work.
All right, well, thank you very much.
All right. Well, enjoy the rest of your day, and
Okay,
thanks for coming
you
by.
too. And again, happy Veterans Day
Thank
to you,
you.
and thank you for your service.
All right.
All